Joining us now is Montgomery Mayor Steven Reed. Mr. Mayor, I really appreciate you making time to come back and keep us updated tonight. Thank you so much.
Thank you for having me.
So tell us about your decision to implement this mask requirement in Montgomery. The state obviously doesn't have a mask requirement. Your city council in Montgomery wouldn't vote for one earlier this week, although it sounds like if they took the vote again now, it might pass. But you've made the decision now to do this by executive order. Tell us about that decision.
Well, Rachel, the decision was one that I've gone back and forth with over the last couple of months, to be honest with you. I really thought this was needed some time ago, but I was trying to work with the city council and build a consensus among them to see what was needed. And we could not get that, unfortunately. And a couple of weeks ago, I was going to bring it up on the agenda, and I did not have the votes at that time. And I told them if we didn't see the numbers flatten, if we did not see a decline in our hospitalization rates, I would be bringing it back again at the next meeting. And that meeting was on Tuesday night. And we had a city councilman who wanted to introduce an ordinance himself, and he brought that ordinance up, and it was not able to pass. But I think when I look back, it's something that I wish I had done probably about a month ago. And I think that we should have pushed the issue more forcefully then, because unfortunately, this has become political football. I don't know how a public health emergency can become that, but I think it has. And unfortunately, I think it's cost us not only the health of many people in our community, but I think it's also cost us some lives. And that's unfortunate. And so I kind of wish I could have a do-over and that we had pressed this more some weeks ago.
You know, we've spoken a few times over these past few weeks since you first sort of sounded the alarm that Montgomery's hospitals were being taxed, that Montgomery's hospitals were at capacity in terms of what they could handle. And we've seen the hospitals flex and surge space. But are things getting any better in terms of the status of the epidemic in the state and in Montgomery specifically? How are your case numbers? Is that curve coming down at all? Has the public alarm in Montgomery about how hard you've been hit caused any sort of changes in behavior that is moving this thing in the right direction yet?
I think it has caused some people to change their behavior. I think it has certainly brought more awareness to the issue. Unfortunately, we haven't seen that spread through this community enough. Right now, 70% of new cases of COVID-19 are Black. 90% of those on ventilators are people that are Black as well. And so when we think about that, this not one event here or there. This is an issue that is really impacting the Black community disproportionately. And I think in part that is because nationally, 1 in 6 workers on the front lines are Black, and we see that a lot here as well. I would say even more than 1 in 6. Those are people who are working in our grocery stores. They're working in our pharmacies. They're working in our retail shops. They're working in public transit. They're having to publicly interface with people who are not wearing masks, who may be unknowingly spreading this virus. And that is unfortunate because whether or not someone has it or not, we know that they can spread it to someone who is susceptible to it. And I think that's driving up the numbers. And so while there's been some movement on people staying at home and practicing social distancing, there has not been enough. And that's why I thought that if the city council was not able to pass it, that I would do it by executive order. And that's the first time that I've used an executive order to issue mandate such as this. And I don't like to do that. But I think when you're in the position that we are as mayors, you have to make decisions in the best interest of your community, even if your legislative body doesn't agree and may not see it the way you do.
I'm struck tonight by you saying that as sort of radical a decision this is for you. You haven't used executive orders before. You tried to avert it. You tried to do it some other way, but you still wish you had done it a month ago. You still wish you had done it before. I have to tell you, we spoke with the infectious disease chief at UAB a few days ago, and she said that what happened in your city first in Alabama, in Montgomery first, is now happening all over Alabama, that they're seeing surges in all sorts of cities, including hospitals really being put through their paces. Just want to ask if you could give one piece of advice to your fellow municipal leaders who are about to start going through what you've been through in Montgomery over these past few weeks, people who are about to start to have it as tough as you've had it, what one piece of advice would you give them?
I would tell them to trust their instincts, look out for their community, look out for the health of their residents, and make sure that we don't allow consensus building in this time to cloud the issue, to make sure that we don't allow politics to cloud the issue of the health and wellness of the people that are counting on us to lead and to make decisions. And I think sometimes when you try to do things by committee, like we often do, whether it's at the local, state, or federal level, it may work. But in this case, I think it takes bold leadership, courageous leadership to really make these decisions on the front side and to really guard against anything that may happen, such as a surge or a spike in cases, because we're trying to bring people along who may never come along. And I think what we have to realize is that people want to see us make these decisions, and people want to see us look out for the health and wellness of them and their families. And they'll understand in the long run, even if things don't surge or if they don't see a spike, that we were doing things in the best interest of the people and not for any other reason.
Wise words and well put. Montgomery Mayor Steven Reed, thank you so much for joining us tonight, Mr. Mayor. As always, please keep us apprised. We are very focused on what's happening in your city and your state, and we're worried about the numbers in Alabama. We're worried about your hospital capacity. We're happy to keep the national focus on this as best we can. Thank you, sir.
Always a pleasure.